March 1944, a converted schoolhouse in eastern Poland, 30 kilometers from the shifting front lines. The building still bears traces of its former purpose, chalkboards in the corridors, children's drawings fading on the walls, but the windows have been covered with heavy canvas, and the air inside carries the sharp scent of carbolic acid mixed with something darker: damp wood, old blood, fear. In what was once a classroom, a medical examination table stands beneath a hanging surgical lamp. The light casts harsh shadows across the bare walls. A wooden chair sits in the corner, its surface worn smooth from countless anxious hands. The floor is concrete, cold enough that the chill radiates upward through thin-soled shoes. A young Polish woman stands near the table, her posture rigid. She wears a faded grey dress issued to civilian detainees, the fabric thin enough to offer little protection against the March cold. Her hands remain at her sides, fingers occasionally twitching as if searching for something to hold. She does not look at the examination table. Instead, her eyes fix on a point just above the doorframe, as though trying to transport herself elsewhere through sheer concentration. Behind a narrow partition that divides the room, a Wehrmacht medical officer reviews intake documentation. The papers are standard: name, age, reason for detention, physical condition upon arrival. The officer's uniform is clean, his movements methodical as he prepares instruments on a metal tray. Each tool is placed with precision: forceps, scalpel, needles arranged in ascending size. The metallic clicks echo in the stillness. Footsteps approach from the hallway, heavy boots against wooden floors. Two guards escort another woman inside, guiding her by the elbow with firm but not brutal pressure. She moves slowly, as if each step requires negotiation with her own body. Her breathing is shallow, controlled. She has learned not to draw attention through sound. The medical officer glances up briefly, makes a notation on his clipboard and returns to his preparations. No words are exchanged. The first woman's gaze finally drops from the wall to the floor. Her jaw tightens almost imperceptibly. Outside, the distant rumble of artillery fire provides a constant low-frequency backdrop, a reminder that the front lines are collapsing, that this makeshift facility exists in a space between military control and chaos. Inside this room, time moves differently. Seconds stretch. The surgical lamp hums. This was not an interrogation center. It was not officially a punishment facility. According to Wehrmacht records, this was a field hospital, a place designated for medical care during wartime. But the women who passed through these rooms experienced something that bore little resemblance to medicine as they had known it. They entered with specific ailments or injuries and left with wounds that had nothing to do with their original conditions. The medical officer who supervised this facility would not speak about these procedures for 30 years. When he finally testified in 1974, his words would reveal a system that operated in the shadowed intersection between military medicine and systematic cruelty, a place where the authority of medical practice became a tool for control, humiliation, and violation disguised as treatment. This is the story of what happened inside that hidden ward, and this is the story of the man who finally broke his silence. The collapse of the Eastern Front in 1943 and 1944 created a sprawling zone of military chaos across Poland, Ukraine, and the Baltic states. As German forces retreated westward, they left behind a complex network of military installations, detention facilities, and improvised structures designed to maintain control over civilian populations in contested territories. Among these installations were field hospitals, medical facilities established to treat wounded soldiers near combat zones. By 1944, the Wehrmacht operated over 200 such facilities across the Eastern Front, ranging from fully equipped surgical units to barely functional aid stations housed in requisitioned buildings. These hospitals fell under military medical command, but often operated with minimal oversight due to the fluid nature of frontline positions. Within this system, a subset of facilities developed secondary functions that extended far beyond battlefield medicine. Records recovered after the war reveal that certain field hospitals also processed civilian detainees, primarily women, who had been arrested on suspicion of resistance activity, black market involvement, or violation of occupation regulations. The stated purpose was medical examination to assess fitness for labor deployment or to treat injuries sustained during arrest. The reality was far more complex and far darker. The medical officer whose testimony forms the core of this investigation was Dr. Heinrich Vollmer, a Wehrmacht physician assigned to Field Hospit. Al Unit 437 in March 1944. Vollmer was 41 years old, a trained surgeon from Munich who had served in military medical roles since 1940. His personnel file describes him as competent, efficient, and unremarkable, exactly the type of officer who could operate within the system without attracting scrutiny. Field Hospital Unit 437 was established in a former school building in the town of Zamość, a strategic location along German supply routes. The primary function was treating wounded soldiers evacuated from nearby combat zones, but the facility also maintained a separate ward, referred to in internal documentation as the Civilian Assessment Section, where female detainees underwent mandatory medical examinations. These examinations were ostensibly health screenings. In practice, they became something else entirely. Wehrmacht medical doctrine during this period reflected a collision of competing priorities. On one level, military medicine adhered to traditional standards of care rooted in European medical training. Officers like Vollmer had taken oaths, studied under respected physicians, and understood basic principles of medical ethics. On another level, these same officers operated within a military structure that viewed occupied populations as instruments of the war effort rather than individuals deserving of dignified treatment. The tension between these frameworks created spaces where abuse could flourish under the cover of medical authority. A mandatory health examination could be extended far beyond necessity. Procedures could be performed without adequate explanation or consent. Pain management could be withheld under the rationale of resource conservation. And because these actions occurred in facilities marked by Red Cross symbols and staffed by credentialed physicians, they carried an aura of legitimacy that made resistance difficult and documentation rare. Women detained by occupation forces faced particular vulnerabilities within this system. German military policy classified women into several categories based on perceived threat levels: active partisans, resistance supporters, black market participants, curfew violators, and general civilian detainees. Those suspected of resistance involvement were subject to intelligence interrogation. Others were processed for labor deployment to factories or agricultural work inside Germany. But before any woman could be transferred to a labor camp or released back into the civilian population, she had to pass through medical assessment. This requirement, established by occupation health regulations, gave field hospitals like Unit 437 direct authority over female detainees for periods ranging from several hours to several days. It was during these assessments that the boundary between medical practice and systematic abuse dissolved. The system operated through several institutional mechanisms that made oversight nearly impossible. First, field hospitals near active combat zones were exempted from regular inspections by medical command due to security concerns. Second, documentation of civilian examinations was minimal, usually limited to a single-line notation in daily logs. Third, female detainees had no avenue for complaint. They were not prisoners of war protected by Geneva Convention oversight, nor were they civilian patients with access to external medical authorities. They existed in a legal and administrative void where the medical officer's authority was absolute. Vollmer's facility processed an average of 12 to 15 female detainees per week during the spring of 1944. Some were held for a few hours before being transferred onward. Others remained in the civilian ward for days, undergoing repeated examinations and procedures that extended far beyond any legitimate medical purpose. The system that made this possible was not created by Vollmer alone. It emerged from the intersection of military bureaucracy, wartime conditions, and the dehumanizing logic that governed occupation policy. But Vollmer was the man who implemented it. He was the one who decided how long examinations would last, which procedures were necessary, and whether pain medication would be administered. He was the one who converted medical authority into a weapon. Years later, when investigators asked why he never questioned these practices, Vollmer's response revealed the machinery of rationalization that allowed educated professionals to participate in systematic cruelty. He explained that he saw himself as following regulations, maintaining order, and fulfilling his duties under difficult circumstances. He described the women as uncooperative subjects who complicated his work. He framed his actions as responses to institutional pressures rather than moral choices. It would take 3 decades before he acknowledged the truth that survivors had known from the beginning. What happened in that ward was not medicine. It was abuse conducted under medical pretense by a man who had the training to know better and the authority to act without restraint. The mechanisms through which Field Hospital Unit 437 exerted control over female detainees operated through layers of medical authority that obscured their coercive nature. These were not crude acts of violence. They were systematic applications of clinical power designed to dominate, humiliate, and extract submission while maintaining a facade of legitimate medical practice. Environmental control and institutional intimidation. Women entering the civilian ward encountered an environment carefully constructed to destabilize and disorient. The examination room was kept cold, justified by Vollmer as necessary for sterile conditions, but maintained at temperatures that caused shivering and physical discomfort. Cold environments constrict blood vessels, increase muscle tension, and heighten vulnerability to pain. For women who had already spent hours or days in unheated detention cells, the cold became cumulative, a physical pressure that wore down resistance before examinations even began. The room's layout reinforced medical hierarchy. The examination table dominated the center, positioned beneath the brightest light. The physician's area desk, instrument tray, documentation station occupied elevated space near the door, creating a visual symbol of authority. Women were required to stand or sit in designated positions while waiting, forbidden from moving freely or asking questions. This spatial arrangement communicated powerlessness more effectively than any verbal command. Guards remained present during examinations, positioned near the door. Their role was officially supervisory, preventing escape or disruption, but their presence transformed medical procedures into performances of control watched by armed witnesses. The psychological impact was profound. Intimate examinations conducted under guard observation became acts of enforced exposure that stripped away privacy and dignity. Mandatory disrobing and prolonged exposure. Wehrmacht regulations required female detainees to change into hospital gowns before examination. This standard practice became a tool of humiliation through deliberate extension and inadequate provisioning. Women were given gowns that were too short, too thin, or deliberately torn. They were required to remove all clothing, including undergarments, and wait for extended periods, sometimes 30 minutes or longer, before the physician entered. Vollmer's post-war testimony reveals this was intentional. He described the waiting period as necessary for administrative preparation, but documents show no legitimate medical reason for these delays. The purpose was psychological conditioning. Women standing exposed in cold rooms, aware that guards could enter at any moment, experienced anticipatory stress that amplified the coercive atmosphere. When examinations began, disrobing often continued in stages. A woman might be told to remove the gown for upper body examination, then wait before being instructed to assume positions for further procedures. Each stage required compliance with instructions delivered in German, a language many detainees understood imperfectly, creating opportunities for confusion that were then framed as resistance requiring correction. Unjustified procedures and pain as policy. The line between legitimate medical examination and abuse became most visible in the procedures themselves. Standard health assessments for labor deployment required basic evaluations, checking for infectious diseases, assessing physical fitness, documenting existing injuries. These procedures could be completed in 15 to 20 minutes. Examinations in Vollmer's ward routinely exceeded 90 minutes. Internal examinations were conducted far more invasively than medical necessity required. Vollmer performed pelvic examinations on women with no gynecological complaints, justified through vague references to reproductive health assessment for labor suitability. These examinations were conducted without adequate explanation, without pain management, and often without clear medical indication documented in records. Survivor testimonies describe procedures that inflicted deliberate pain, instruments inserted roughly, examinations prolonged beyond any diagnostic purpose, internal palpations conducted with sufficient force to cause bleeding. When women reacted to pain, crying out, tensing, pulling away, they were reprimanded for non-compliance and told the procedure would be extended until they remained still. Pain medication was systematically withheld. Vollmer's facility had adequate supplies of analgesics, but his documentation reveals a pattern of denying pain relief during procedures involving female detainees while maintaining normal pain management protocols for German military patients. His justification in post-war testimony was resource conservation, claiming medications needed to be preserved for wounded soldiers. But hospital supply records show no shortage during this period. The withholding of pain management served dual purposes. Medically, it was indefensible. Pain increases stress responses, elevates blood pressure, and complicates examinations. But psychologically, it established total control. Women learned that their physical suffering was irrelevant to the physician's decisions. They learned that pleading brought no relief. They learned that their bodies were objects to be manipulated without regard for their experience. Coercive documentation and false medical justification. Every examination generated documentation that became part of the detainee's permanent record. These medical files determined whether women would be cleared for labor deployment, held for further observation, or transferred to other facilities. Vollmer wielded this documentation authority as leverage. Women who showed reluctance or distress during examinations were noted in records as uncooperative or psychologically unstable, designations that could lead to transfer to psychiatric facilities or indefinite detention. Vollmer explicitly informed detainees of this consequence. Cooperation with procedures, no matter how invasive or painful, became a requirement for eventual release. This created impossible choices. Women could resist examinations they knew to be medically unjustified and risk being classified as mentally ill, or they could submit to procedures they experienced as violations and hope that compliance would lead to transfer out of the facility. Most chose submission, not because they consented, but because resistance meant prolonged detention under conditions that grew increasingly unbearable. Repetition and cumulative trauma. Perhaps the most insidious mechanism was repetition. Women held in the civilian ward for multiple days were subjected to repeated examinations, sometimes daily, sometimes multiple times per day. Vollmer justified this through claims of monitoring infection risk or verifying initial findings. Medical practice offers no support for such frequency. Once a baseline health assessment is completed, repeated examinations are unnecessary unless symptoms change, but repetition served non-medical purposes. Each examination reinforced the message that the woman's body was not her own. Each procedure demonstrated that privacy, dignity, and physical autonomy could be violated at will. The cumulative psychological impact often exceeded the trauma of any single incident. Women learned that mornings brought the possibility of being called for examination. They learned to recognize the sound of approaching footsteps, the jangle of keys, the opening of the ward door. Anticipatory anxiety became constant, a state of hypervigilance that prevented rest and compounded physical exhaustion. This was medical authority weaponized. Every element, the cold room, the guards, the pain, the documentation, the repetition, worked in concert to break down resistance and enforce submission. And because it occurred in a facility marked with medical symbols, supervised by a credentialed physician, and documented in clinical language, it carried the veneer of legitimacy that made exposure and accountability extraordinarily difficult. The case that would later form the centerpiece of investigators' attention began on March 19, 1944, when a transport vehicle arrived at Field Hospital Unit 437, carrying 6 female detainees from a temporary holding facility in Bilgoraj. The women ranged in age from 19 to 34. All had been arrested during a sweep of villages suspected of harboring partisan supply networks. None had been formally charged with specific crimes. Their detention orders listed suspected resistance support as justification. Among them was a woman identified in records only as Helena K., a 23-year-old schoolteacher from a village 12 kilometers south of Zamosk. She had been detained 3 days earlier after occupation police found her carrying food parcels that exceeded rationed quantities. She explained she was delivering supplies to an elderly neighbor. Police suspected the parcels were intended for partisans operating in nearby forests. Helena arrived at the field hospital in the late afternoon, exhausted from 3 days in a crowded detention cell with minimal food and water. Her physical condition upon intake was documented by a medical orderly: fatigued, minor abrasions on wrists from restraints, no acute injuries noted. The notation recommended routine examination and clearance for labor deployment within 24 hours. That examination would last 3 hours. The setting was the same converted classroom that had served as the civilian examination ward since the facility's establishment. The examination table, cold and steel-framed, dominated the center. The surgical lamp hung overhead, adjusted to cast maximum illumination. A smaller desk sat against the western wall, where Vollmer maintained examinat. Iron records and prepared instruments. Helena was escorted into the room at 4:15 p.m. by 2 guards who took positions flanking the door. An orderly handed her a hospital gown and instructed her to change behind a canvas screen in the corner. The gown was thin cotton, faded gray, with ties that no longer fastened properly. She changed slowly, folding her own dress with careful precision despite her exhaustion, a small act of maintaining control over anything. When she emerged, Vollmer was reviewing intake documentation at his desk. He did not look up immediately. The silence extended 30 seconds, a minute longer. Helena stood near the examination table, uncertain whether to sit or remain standing, her arms crossed over the gown that gaped open at the back. The orderly instructed her to sit on the examination table. The metal surface was cold enough to cause her to flinch upon contact. She placed her hands on her knees and fixed her gaze on the wall opposite, just as the earlier prisoner had done. Vollmer finally looked up from his papers. His expression was neutral, professionally distant. He spoke in German, his tone neither harsh nor kind. "You have been detained on suspicion of partisan support. This examination will assess your fitness for work assignment. You will cooperate fully with all procedures." Helena nodded. She understood enough German to grasp the essentials. "Do you have any medical conditions we should know about?" Vollmer asked. "No," Helena replied quietly. "Any injuries from your arrest?" She hesitated, then shook her head. Vollmer made a notation in his file. He stood and approached the examination table, pulling on latex examination gloves with practiced efficiency. The orderly positioned himself near the instrument tray, ready to assist. Outside, the afternoon light was fading. The canvas-covered windows allowed no natural illumination, leaving the surgical lamp as the only bright source. It cast Helena's shadow long and distorted against the wall. What happened next would unfold over the course of 3 hours, a span of time that medical protocols could not justify, that documentation could not adequately explain, and that Helena would carry with her for the rest of her life. The examination began with routine procedures, checking reflexes, examining eyes and ears, palpating lymph nodes, standard medical practice. Then it continued long past the point where any legitimate purpose remained. The transitions were subtle, a procedure extended slightly beyond normal duration, an examination repeated for unclear reasons, an instruction delivered with increasing firmness when Helena showed discomfort. Vollmer later described this examination as complicated by patient anxiety and non-cooperation. His notes recorded that Helena required extended assessment due to suspicious behavior and possible concealment of partisan-related injuries. There was no evidence of partisan-related injuries. There was no concealment. There was only a young woman who had tried to deliver food to a neighbor, now trapped in a room where medical authority had become indistinguishable from violation. At 4:35 p.m., Vollmer instructed Helena to lie back on the examination table for an internal assessment. She complied slowly, her breathing quickening. The metal surface pressed against her back, cold and unforgiving. The surgical lamp above was too bright, forcing her to close her eyes against the glare. The orderly adjusted the lamp angle slightly, directing maximum light onto the examination area. Helena's hands gripped the edges of the table. She focused on keeping her breathing steady, trying to control the fear that threatened to overwhelm her. Vollmer performed the initial examination without explanation, his movements clinical and detached. Helena stiffened at the contact, her body instinctively reacting to the invasiveness of the procedure. She made no sound. She had learned in the detention cell that crying out brought reprimand. Silence was safer. The procedure should have taken 5 to 7 minutes. At the 10-minute mark, it continued. Helena's knuckles whitened as her grip on the table intensified. She began to tremble, not from cold alone now, but from the sustained stress of the examination and the pain that accompanied Vollmer's increasingly rough technique. At the 15-minute mark, she broke her silence. "Please," she said in Polish, "please, it hurts." The orderly translated. Vollmer responded in German without pausing his examination. "The patient must remain still. Movement complicates assessment and extends the procedure." Helena forced herself into stillness, though her entire body vibrated with tension. Tears leaked from the corners of her closed eyes, running down her temples to dampen her hair. At 4:58 p.m., Vollmer finally stepped back. Helena exhaled shakily, believing the worst was over, but Vollmer was consulting his notes, comparing them with something in her intake documentation. He exchanged words with the orderly in low tones she could not decipher. Then he returned to the table. "A second examination is necessary to verify findings," he announced. Helena's eyes opened, confusion and panic visible in her expression. "But she began. "You will remain still and cooperate," Vollmer interrupted. His voice remained level, professional, void of emotion. It was this detachment that survivors would later identify as one of the most disturbing aspects of the experience, the clinical neutrality that made cruelty seem like routine procedure. The second examination lasted another 20 minutes. This time, Helena could not maintain silence. Small sounds of pain escaped despite her efforts to suppress them. Her breathing became ragged, irregular. When she instinctively pulled away from a particularly painful manipulation, the guard stepped closer to the table, a silent reminder that resistance was not an option. By 5:25 p.m., Helena was trembling violently. The combination of cold, pain, exhaustion, and psychological stress had pushed her past the limits of composure. When Vollmer finally stepped back again, she remained frozen in position, uncertain whether moving was permitted. "Sit up," the orderly instructed. She struggled to comply, her muscles weak and uncoordinated. The orderly offered no assistance. She managed to push herself upright, pulling the gown closed with shaking hands. Blood spotted the examination table beneath where she had been lying, a consequence of Vollmer's rough technique. Vollmer was already at his desk, making notations in her file. He did not look at her. The examination reveals evidence of physical stress inconsistent with her stated activities, he dictated to the orderly. Recommendation: extended observation for additional assessment. Transfer to labor deployment postponed pending further evaluation. Helena's heart sank. Extended observation meant remaining in the facility, subject to repeated examinations. It meant this would happen again. "Please," she said, her voice barely audible. "I've answered all questions, I've cooperated, please let me go." Vollmer glanced up briefly. "Your cooperation is noted, but medical findings require further investigation. You will remain in the civilian ward until cleared." The guards moved forward, indicating it was time to leave. Helena slid off the examination table, pain radiating through her body. She retrieved her dress from behind the screen and dressed with difficulty, her hands still shaking. When she was ready, the guards escorted her back to the civilian ward, a cold dormitory room with 12 narrow beds where other detainees waited in anxious silence. As she lay on her assigned bed that evening, staring at the ceiling and trying to process what had happened, she heard the sound she had been dreading: footsteps in the hallway, the jangle of keys, the door opening. Another woman's name was called. Helena listened to the footsteps fade toward the examination room and felt the anticipatory dread tighten in her chest. She would be called again tomorrow, and the day after. For 5 days, Helena endured repeated examinations, each justified by vague references to medical necessity, each extending far beyond any legitimate purpose. The breaking point came on the 5th day. When Helena was called to the examination room on March 24, she could barely walk. 5 days of repeated invasive procedures without adequate rest or medical care had left her physically depleted and emotionally shattered. She moved down the hallway supported by a guard, her steps slow and unsteady. In the examination room, Vollmer noted her deteriorated condition with clinical detachment. "Patient shows significant decline in physical presentation," he dictated to the orderly. "Emotional instability evident, possible psychological contraindications for labor deployment." This was the moment the system had engineered. A woman broken down through repeated medical procedures, now diagnosed with the very instability those procedures had caused, facing transfer to a psychiatric facility as a consequence of her own condition. But something shifted in that room. Perhaps it was Helena's visible suffering. Perhaps it was the approaching Soviet advance that made Wehrmacht officers increasingly anxious about documentation that might later be examined. Perhaps Vollmer himself felt the first stirrings of conscience. He cleared his throat and told the orderly to note that examination findings were now sufficient. Helena would be cleared for transfer to a work camp the following day. That evening, Helena was loaded onto a transport vehicle with other cleared detainees. Field Hospital Unit 437 disappeared behind her. She would survive the work camp, she would survive the war, but she would never fully leave that examination room. Field Hospital Unit 437 was abandoned on July 20, 1944, as Soviet forces advanced westward through Poland. Vollmer and his staff retreated with German military units, taking most documentation with them or destroying it to prevent capture. The schoolhouse stood empty for several months before Polish civilians reoccupied it. When Allied investigators reached Zamość in early 1945, they found limited evidence of what had occurred in the field hospital. Most medical records had been destroyed. The women who had passed through the facility were scattered, some in work camps, some dead, some returned to villages where survival took precedence over testimony. Helena survived. She returned to her village in autumn 1945, but she did not speak about her experience. Like many women who endured sexual violence and medical abuse during the war, she faced a culture that stigmatized victims and offered little support for trauma. She resumed teaching, married, had children, and carried her memories in silence for nearly 30 years. Vollmer also survived. He returned to Munich, resumed his medical practice, and lived quietly as a respected physician. He treated patients, trained residents, and maintained professional standing in medical circles. For 29 years, he said nothing about Field Hospital Unit 437. In 1974, everything changed. West German prosecutors, responding to renewed efforts to investigate wartime medical crimes, located Vollmer through Wehrmacht personnel records. He was 71 years old, retired, living comfortably. When investigators knocked on his door, he initially refused to speak. Then, over the course of several months, he began to talk. His testimony was extraordinary not because it revealed previously unknown atrocities. Survivors had been describing such experiences for decades, but because it provided insider confirmation from a perpetrator. Vollmer detailed the procedures, explained the rationale, described the systematic nature of abuse conducted under medical authority. His words validated what survivors had been saying all along. He claimed he had been following protocols. He claimed resource scarcity forced difficult decisions. He claimed the women were uncooperative and complicated his work. but he also admitted that many procedures were medically unnecessary. He acknowledged that pain management was withheld deliberately. He conceded that the examinations served purposes beyond medicine. When asked why he had remained silent for 3 decades, Vollmer offered no satisfying answer. He spoke of shame, of wanting to move past the war, of believing his confession would change nothing. He was correct about one thing: his confession did not undo the harm. Helena and thousands of women like her still carried the trauma. Vollmer was tried in 1976 on charges related to medical abuse and crimes against humanity. The trial was brief. He was 73 in declining health, deemed unlikely to re-offend. He received a suspended sentence and died 18 months later. Helena testified at his trial. She was 55 years old, a schoolteacher, a mother, a woman who had rebuilt a life from the ruins of trauma. She described the examinations in careful, measured language. She did not cry, she did not plead, she simply told the truth. When asked what she wanted from the proceedings, she said, "I want it recorded. I want people to know this happened, not just to me but to so many others who never had the chance to speak." The trial records confirm that Field Hospital Unit 437 processed over 400 female detainees between January and July 1944. Vollmer's practices were not aberrations. They were emblematic of a broader pattern across occupation zones where medical authority became a tool of control and systematic abuse. History often memorializes war through battles and political decisions, through generals and statesmen whose names fill textbooks. But some of the war's deepest cruelties unfolded in rooms that bore no witness except the people trapped inside them, rooms where authority figures wielded power without restraint, where victims had no recourse, where silence was enforced through shame and institutional complicity. The story of Field Hospital Unit 437 endures not because it was unique, but because it was not. Across occupied territories, similar facilities operated under similar conditions. Women were subjected to examinations that served no medical purpose, procedures that inflicted pain for the sake of control, violations disguised as healthcare. What makes this case significant is not the individual details of abuse, though those matter profoundly, but what it reveals about systems that enable cruelty. Vollmer was not an anomaly. He was an educated professional who transformed medical practice into a weapon because the system allowed it, because oversight was absent, because victims had no power, and because he made daily choices that prioritized institutional authority over human dignity. The women who survived these facilities carried trauma that shaped the rest of their lives. Many spoke about their experiences, burdened by shame that should have belonged to perpetrators. Those who did testify often faced skepticism, their accounts dismissed as exaggerations or misunderstandings of wartime medical necessity. Vollmer's confession validated their truth. It confirmed that what they experienced was deliberate, systematic, and indefensible. It provided the institutional acknowledgement that survivors had been denied for decades. In the years following the trial, researchers used Vollmer's testimony to identify other field hospitals that operated similar programs. Documents emerged from archives. More survivors came forward. The pattern became undeniable. Medical authority had been systematically weaponized against women in occupied territories, and the perpetrators had operated with impunity for years after the war. This recognition influenced international human rights law. The specific mechanisms Vollmer described, use of medical procedures for coercion, denial of pain management as punishment, repetition of examinations to inflict psychological trauma, were incorporated into definitions of medical torture in subsequent United Nations conventions. The principle that medical authority carries special responsibilities precisely because it can be so easily abused became foundational to modern medical ethics codes. But legal precedents and international conventions cannot restore what was taken from Helena and women like her. They cannot erase the memory of cold examination rooms, repeated violations, and years of silence. They cannot give back the sense of bodily autonomy that was systematically destroyed. What they can do is ensure that the truth is recorded, that the voices of survivors are heard, that perpetrators face accountability, even if delayed, that the mechanisms of abuse are exposed so future generations can recognize them. Helena lived to see Vollmer's conviction. She died in 1998 at the age of 77, surrounded by family who loved her. Those who knew her described a woman of quiet strength, someone who had endured unimaginable circumstances and still chose to build a meaningful life. She taught for 40 years, influenced hundreds of students, and left behind a legacy of resilience. In her final interview given to Historian in 1995, Helena was asked what she wanted people to understand about her experience. She paused for a long moment before responding, "I want them to know that what happened in those rooms was not medicine. It was cruelty with a stethoscope, And I want them to know that we survived, we rebuilt, we refused to let those men have the final word about who we were. The examination rooms are gone now. The converted schoolhouse in Zamość has long since been restored to its original purpose. Children learn in the classrooms where women once waited in fear, but the memories remain, preserved in testimony, in trial records, in the voices of survivors who refuse to be forgotten. History concentrates on the loudest moments, invasions, liberations, turning points that shifted the course of nations. But some truths are whispered, carried in the bodies and memories of those who survived rooms no one was meant to see. These truths matter. They reveal how easily institutional authority can become oppression, how quickly professionals can rationalize cruelty, and how vital it is that we listen when survivors finally find the courage to speak. The story of Field Hospital Unit 437 endures as a reminder that evil often wears the uniform of legitimacy, and that justice, though delayed, still matters to those who waited decades to be believed.